Welcome to this edition of the Designs for Health audio science article.
Bone morphogenic protein supplementation for osteoporosis and osteopenia. Most patients with osteoporosis or osteopenia who want to optimize their bone health take supplemental calcium, vitamin D, vitamin K, and typically some trace minerals found in most bone support products. On the other hand, patients with joint pain tend to gravitate toward nutrients such as glucosamine, chondroitin, and methylsulfonylmethane or MSM. Research shows that our bodies need a unique bioactive protein complex to help make these nutrients work. What makes this complex so unique is the natural array of growth factors and stem cell activating proteins known as bone morphogenic proteins, or BMPs for short. Bone morphogenic proteins are what cause the bone to regenerate. This is a significant breakthrough, as these proteins have good clinical indications for osteoporosis, osteoarthritis, rheumatoid arthritis, osteopenia, and fractures. BMPs work at the cellular level where they become chondrocytes, which produce cartilage, or osteocytes, which produce bone tissue. These cause a complex set of reactions, along with anti-inflammatory properties that encourage healing at a very quick rate. Many patients see a change in their symptoms during the first week. Oral supplementation with BMPs has been shown to have a direct effect on bone metabolism with no cases of adverse effects. There are important factors to consider in determining a proper therapeutic dosage, such as the number of joints affected by body weight, severity of the condition, and family history. For example, in osteopenia and osteoporosis, it is important to look at the rate of decline in bone loss to determine an appropriate dose. In addition to DEXA scans, bone resorption assay may be considered, which measures the deoxypyridinoline fragment of type 1 collagen breakdown from a single urine specimen, or the bone formation marker bone alkaline phosphatase, or BAP. These are relatively inexpensive to test and are cost-effective tools to routinely monitor bone resorption rates and the effectiveness of therapy. When taking BMPs, it is recommended to start with a loading dose and then titrate down. Bone loss during aging, as well as in postmenopausal women, results from an imbalance between bone formation and bone resorption. Loss of bone strength and an increased number of bone fractures in patients with osteoporosis may be associated with a lower content of BMPs and growth factors in the bone's matrix. Since BMPs are considered bone anabolic agents, they can play an essential role in decreasing the progression and severity of osteoporosis. In addition, a clinical trial demonstrated that these osteoinductive proteins helped yield a significant improvement in the reduction of joint pain and frequency of pain with an increase in activity level and joint strength in those with osteoarthritis. Dosing for joint health, in other words, osteoarthritis pain and inflammation, is typically higher than for osteoporosis. As reported in numerous clinical studies, clinical improvement for degenerative joint disease has been seen within days to weeks. The early effects of bone morphogenic proteins are their immunoprotective properties against pathways that cause inflammation and associated pain. As a result, you have a protein complex that naturally resists breakdown in the gut, activates stem cells, and protects the body from inflammation, resulting in a very rapid onset of action.
Thanks for listening. For more excellent educational content, be sure to visit designsforhealth.com.